Hi there and welcome back to my channel. So I'm back today with a new video topic that I think is really important for every single person who is experiencing low back pain and performance syndrome, and who is also considering or have already been to different physicians but they couldn't pinpoint exactly the root cause of the pain. So I wanted to make a video to include what I think are the most important things to keep in mind on your next visit to your doctor or physio or therapist. You know, you would be really surprised to see the number of people who are inside my Facebook community or who email me telling me that they have been to all of these physicians or therapists and they still don't know what is causing the pain, and they have been to many treatment sessions and they're so lost and they have no idea what is triggering the pain. And even the treatments are not even working for them, but they keep doing them anyways. So the first and most important thing that I think every back pain patient needs to know are their exam results. If you have done scans or even the assessment that the doctor have made you go through, you deserve to be told the results of this test, their interpretation, and all of the details. And you should be taking notes of all of these things. And if the doctor is speaking language that you don't understand, don't be afraid to speak up and ask for clarification. You need to be able to walk away with enough understanding that you're able to explain that again to another person with your own language. You also deserve to be given an explanation of the pain itself, like why it started, the history of the pain, how it was triggered. And the third thing is you want to have a conversation about a recovery plan and your chances for full recovery over the long term, not just the short term. And also the patient should be active in the recovery process. You need to be given a plan that shows you postures and also movement patterns that you should perform outside of the clinic. Like you could be doing a massage or acupuncture or a chiropractic adjustment, but what are you doing outside of the clinic when you're on your own? That's when you are actively working in the recovery, and you need to know what corrective exercises to do, what posture, how to correct your posture, and also what fundamental movement patterns can you incorporate into your life to help you move better in your day-to-day life. And of course, every patient deserves to have the root cause of the pain clearly identified and also explained. You need to know exactly what postures, movements, and things you're doing that are triggering the pain and making it worse, and you need to know how you can correct those movement patterns and postures so that you can avoid the pain and avoid triggering it as you move through your recovery plan. Because here's the thing, you need to have two goals in your recovery. The first goal is to stop the pain. That's when you're focusing all your efforts on finding the root cause of the pain, finding the triggers, eliminating the triggers, and also adjusting your movement patterns on a day-to-day basis so you can avoid triggering the pain and avoiding flare-ups. And then once that goal is reached, the next step is to increase your activity range and start introducing more corrective exercises, because essentially you want your recovery plan to grow with you. You don't want to be just stuck in whatever you're doing and then keep doing it forever. No, you want to keep adding things as you go. As you're getting more pain-free days, then you add another exercise, and then you challenge your body a little more, and then that way then you can be introducing more and more things until you're back to normal, and you can function better, because now you've learned how to move better through postural changes and movement patterns as well, and you have developed the right strength in the right muscles. So please, next time you're going to a new therapist or even your current doctor who has already done an assessment but you're not understanding well why the pain is being triggered, you have to ask them, go back or call them and ask them what are the things that they observed about your posture, what are the things that he thinks you need to correct, and move forward to correcting those postures, because your job is to pinpoint exactly the triggers that are triggering the pain and go and fix them, eliminating them or finding postural changes. Just like the last video when I was talking about the hip hinge versus bending over, that's something that you could have observed yourself or your therapist and he could have pointed out that when you're bending over that may have caused more pain, and he would show you the corrective movement, which is the hip hinge, and now you're moving forward and you're incorporating the hip hinge more and you're experiencing less pain. And then from there you're moving forward to reduce your pain tolerance through corrective exercises, through strengthening. So it's all, everything is working together towards recovery. And you need to be active in the process. You can't just go for 1 hour to get a treatment or an adjustment and then leave and expect that to fix, you know, everything else while you're sitting in a really bad posture, you're standing in really bad posture, you're doing all these things right in the background that are just getting you back to square one, and then you have to go back again, right? Like, you have to be active in the process and be very, very mindful of what you're doing. And believe me, I know it's a little tough in the beginning, but then it becomes very automatic. And one more thing I want to add before I finish this video is, when I say you need to understand the root cause of the pain, it's not just saying things like words like, oh, you have performance syndrome, or you have this and that. These are just words. Like, it doesn't mean anything to you. You need to understand what that means. And it's not about just adding things, you know, like adding more exercises, adding more stretching. It's also the things that you should stop doing, like the things that you should be eliminating or changing. Because remember, what you don't do is just as important as what you do. Like, the things that you have to eliminate or change are just as important. Sometimes it's actually better to reduce things, you know, cut out stretching, maybe stretch just once a day versus 5 times a day, like I used to do. So look at your lifestyle, look at your habits, all the things that you're engaging in, and you have to work with your physician to really pinpoint all of those things that are triggering the pain, making it worse, and making adjustments accordingly. So this is just a quick video because I felt like I needed to say something about that, because I've been talking to so many people who are just not getting a clear understanding of their pains, and they spend years investigating and trying to find the root cause of the pain. If your therapist is not providing that information for you, you need to be looking elsewhere. I've also created a really simple PDF that outlines some very important things that you have to follow. So thank you guys so much for watching. Again, if you have any video requests, please comment below and let me know. And also, don't forget to subscribe to my channel, and I'll see you guys next time.